Now, I've seen different reports, people saying that's going to be taxed, and that's not correct. Okay, it is not going to be taxed at this time. Whether it will be taxed in the future is a question mark. Remember, we're spending a lot more money. The initial projections of this, the president said, I want health care reform at $900 billion, and it came in at $953 billion. And then when they rescored it correctly, they said it's going to be over $1.3 trillion, and I've seen estimates as high as $2 trillion. And the Congressional Budget Office, they score things based on what they've seen, not what, if you say it's going to save $1 million, they say it's going to save $1 million. So they only score on what they've been given. So if you give them a rosy picture, they're going to score a rosy picture. If you give them the reality, it turns out to be a lot different. But the things on the W-2 will be there in the future. In 2012, there's going to be an employee tax. It's called the comparative effectiveness tax that the government's going to be putting on every employee. Now the question is who's going to be paying that, but ultimately someone's going to be paying it, the employer or the employee. It's a $2 tax for comparative effectiveness. So the government's going to be trying to decide how effective all this is. So they're going to be putting a tax of $2 on every employee.
So they can do a study.
So they can do a study to find out if what's working and not working, I guess. But it's called the comparative effective tax.
Mm-hmm. They couldn't get some grad students to do this for free?
I'm not sure. In 2013, there's going to be an additional 0.9% Medicare tax for people that make over $200,000, not $250,000. For people that make over $200,000 a year. There's also going to be an increase in Medicare tax by 3.8% for an unearned income for people that have adjusted gross incomes of over $200,000. The big changes that are going to occur, and when we spoke a little bit earlier, I think the thing to remember is this all going to be implemented? People ask me every day, what can we do? The 65% of Americans that are unhappy, how can we stop this? What can we do? What can Congress do? Well, if the political aisles change, maybe something can be done on the implementation. In 2014 is when the floodgates open up, basically. That's when guarantee issue comes into play, meaning that somebody can get health coverage no matter what, guarantee issue. There will be no pre-existing conditions for anybody. Remember, in 2010, it's going to be for under 19, but in 2014, it will be for everyone. Mm-hmm. I'm trying to think of the other issues. There will be oversight on premiums. So one of the things that's been going on right now that's been a lot of controversy is in California. In fact, some people will say when a big insurance company started raising premiums dramatically, that's when healthcare reform was kind of dead, and then it was revitalized because of healthcare reform, because of healthcare premiums being increased in California. The government is now going to look and tell basically companies whether they can raise their premiums or not. That to me is a little bit disturbing because that's the government telling private industry what they can and can't do with regards to it. It's kind of an interesting statistics. You hear people say all the time, well, the insurance companies have all the money. Well, I looked up last night on the internet the gross or the profit margin for a couple big insurance companies, and then I looked at the profit margin for Microsoft. For an insurance company, they average between 3 and 4 cents on a dollar, or 3 to 4%. Now, the reason that an insurance company might have a lot of profit is because we're talking about lots of dollars, okay? But 3 to 4 cents on a dollar, whereas Microsoft makes about 30 cents on every dollar. So big difference. But when you're seeing the government saying we got to keep cracking down on what insurance companies are making in their profits and whatever, it's kind of an interesting situation.
Didn't I hear something about that the government wants to keep administrative costs of insurance companies down, but at the same time, the administrative costs are what are normally called customer service?
Well, it's a really good question. And in 2006, the CMS, the Center for Medicare and Medicaid Services, said that 85 cents of every dollar goes to claims. The remaining 15% is for everything else. That's for insurance company profits, it's for other services, it's for me as someone helping people find the right programs and whatever. So that 15 cents or 15%, that's where that is. The government has said, and it's called minimum loss ratios. They basically are establishing this year minimum loss ratios. For large groups, it's going to be 80%, and for small groups, it's going to be 85%. Let me just check my notes to make sure I've got that and I didn't reverse it. 85% for large, 80% for small groups. So what they're saying is that 80% is going to go towards claims for small groups, 85% for large groups. So the answer to your question is they're saying that the insurance companies, whatever your margin is, and all the administration and everything else has to occur in that 15%, that 15 cents or 15%. The problem that when you asked earlier about the healthcare reform and how we looked at it and changing it for 250 million people is that all this debate has been over the 15 cents. It's not been over the 85 cents. And if you really want to have an impact on healthcare long term, because remember, healthcare premiums are basically a result of how much healthcare we're receiving, okay?
No, it's actually based on how much people are being billed for services. It's not how much healthcare again, it's how much the bills actually, the numbers on those bills.
Absolutely, and how much. But health insurance is expensive because healthcare is expensive.
Well, the numbers keep going up.
And they're going to keep going up.
I could never understand how the Congress could pass a law that says that private businesses have to provide services to people who can't afford it.
Mm-hmm.
And then, of course, then the complaint is, well, we've got to make everybody insured because, well, it's costing everybody else. But the reality is it wouldn't be costing everybody else had Congress not mandated that these companies have to treat people who can't afford to be treated.
Right. It's a good point. Another thing that I failed to mention that's happening in 2010 is all the limits are being taken off. So if you had a lifetime limit of $1 million for your health insurance or $5 million, it's going to be unlimited now. In Missouri, a good example, we just passed some legislation with regards to autism spectrum disorder.
Yes.
And for 2 years they debated on basically how much money was going to be set aside for it. You know, was it going to be $32,000 or $50,000? They ended up settling at $40,000, and that was passed in the last legislative session in Missouri.
So this means
but
there is
this
none.
means there is no limit. So, you know, the thing to understand is the president's number one priority, he said, was to make things affordable. Okay. He also said, "I'm going to make it so that you can keep your health insurance." So let's talk about that. Well, when you make things guarantee issue, meaning that everybody can get it with no pre-existing conditions, in my world, and I've worked in insurance for 31 years, that doesn't make insurance less expensive. It makes it more expensive. I'm not saying it's not the right thing to do or with regards to covering people, but it doesn't make it less expensive.
In a world with unlimited resources, of course you want to do everything for everybody.
And we always
everybody
want
gets
that.
a heart transplant. Everybody gets a hip replacement.
Maybe in the United States, and maybe now, but maybe not in the future. And that's not how it works in countries that have government-run health care.
Well, I'm saying that if with unlimited resources, all these things are possible.
Right.
But we don't have unlimited resources.
Right.
And our system now is, what, 1/6 of the entire economy of the United States, which is a considerable number of dollars.
Right.
I just don't see, honestly, I just don't see how we can continue down this path of providing this extraordinary amount of health care to this extraordinary number of people.
Well, and again, the question coming back to, is it affordable? I don't think it's affordable or sustainable. It's kind of interesting. Orrin Hatch was interviewed a few months ago from Utah, and the news person asked, "How is this healthcare reform going to work?" And he said, "It's not going to work." And he said, "What do you mean?" He said, "It's not going to work." He said it was not supposed to work because it's not affordable or sustainable in the long term. And he said it was designed to fail so that the government can come in and say, basically, this is the option, the government plan. I mean, when the government when there's a government plan.
We got about a little less than 5 minutes here, just so you know. Okay, so the system fails, the private system fails, and now the public system is put into place that you've just described, the government doesn't have money. I mean, you know, the only money that they have is that which they take from people who actually create wealth.
Right.
Okay, so if the private system couldn't afford to pay for this, how is the public system supposed to afford this? Or is what's really going to happen is that with limited resources, they're going to say, okay, you're over 70, so that heart bypass, no. You guys that are over 85, all that treatment for diabetes, no. Is that the glide path?
Well, the president says no, but if you look at all the other countries that have government-run health care, the answer is absolutely. They ration care. It takes, you know, some people don't get the coverage. They go to other countries, or they come to the United States. The reality is a lot of them, and I think we talked about it last time, the premier or whatever of Canada had heart issues. Where did he go to have treatment? He came to the United States to have treatment. A lot of people cross the border to have treatment here. And we're not even talking about illegal immigrants that are adding to the whole problem with regards to the health care system. Again, the question is this affordable and sustainable in the long term? Will you be able to keep your same plan? There's an issue of what's called grandfathering, which we didn't talk about. Maybe I'll just maybe bring it up if we have just a quick second. Grandfathering. If someone changes their deductible, remember the president said you can keep your own plan, okay? Well, if you change your deductibles, or you change your co-pays, or you change your co-insurance more than medical inflation, then you have to get in the government-run program, or a government program that's offered through the exchanges. So you have to change it. Yeah, you can't. Right. But if you do any of those things, and what do I do as a broker? Well, we're trying to adapt. Change deductibles, change co-insurance, change co-pays to try to keep employers whole in where they are, because they still want to offer the same level of benefits. But if you make any of these changes, then you won't be grandfathered anymore. You're going to have to go into the exchange, which we didn't talk about, but the exchanges also start in 2014, and that's going to be basically a place where you can go and buy individual or group coverage. That's going to be the states are going to run those exchanges, and that'll be the place where you can buy insurance. Can you go in the private marketplace? Yes, but as we've seen in the past, they make a lot of incentives for you to go into the state plan or into the government plan. So the question of, is it going to be affordable, and am I going to be able to keep my own health insurance? I think the answers are both absolutely not in the long term.
See, I just want to get in. If my son's got a good plan, I want to be on his plan.
Yeah. Maybe they should if you're 40 or 45 years old, you can stay on your kid's plan instead of the 26-year-old staying on our plan.
Yeah. Well, we're down to probably the last minute or two here. I'm being told it's a minute left. Okay. So, is there anything in the next 30 seconds that you've forgotten to say that you definitely want to get out here?
Well, I think that your vote's going to be very important in November. If you're one of the 65% of Americans that are against this healthcare reform, the answer is that your vote can make a difference in November and in 2012. Because otherwise, the government's going to do exactly what it wants to do, whether we like it or not, whether it's affordable or not. That's what they've been doing for the last 19 months. So that's what we can expect going forward.
So change decision makers is what you're saying.
That's what I'm saying.
Right. Well, thank you very much for being with us today. We appreciate having you here. My guest is Ken Schmidt. He is a health insurance broker, and he had a lot of interesting things to say. It went by pretty fast. Hopefully you caught on to this. But the most important thing that he just said was, go vote and change decision makers if you're not happy. I'm Lee Presser. We'll see you next Monday.